what the owner did after that. Sue. You gotta be careful. So you gotta properly restrain these animals when you're doing these examinations. Okay? And pyoderma. What's pyoderma? That's a set infection of the skin, right? Where you get it very often is on the paws. And you see there, see how swollen the pads are underneath on that paw? And we did a histosection and see you have particular areas filled with inflammatory cells and everything. So severe. And what's the animal going to not want to do? Walk. And what's that going to do to making visits to its food dish and all that type of thing? Not wanting to. Okay. Also, calcinosis cutis. Y'all know what that is?
Accumulation.
Like y'all had that in past, didn't you? Don't tell me you didn't, because I distinctly remember going through when I a couple of times put these exam questions together. I distinctly remember that, right?
Yeah.
Okay.
Accumulation.
Accumulation of it can usually is dystrophic. What's dystrophic mean? Deposition of what? In damaged tissue versus metastatic, which is a normal tissue. Okay. So calcinosis cutis is basically, can be a relatively uncommon manifestation, seen more often in dogs. And you see where we've deposited these calcium deposits in this damaged skin from this dog. And that can just cause more severe problems. And also you can see problems of calcium redistribution in other organs with this disease. Okay? Here's another one. See how severely you get ulcerations and everything else in this poor little dog. Okay? That one right there. Makes you hurt, doesn't it? And this is just showing you calcinosis. His normal histological section. Well, not normal here. If you look at this section, you can see all the inflammatory cells. And if you go a close-up, what's that dark purple stuff in there? That's your calcium. It's the stain as far as calcium is concerned. Okay? Abdominal enlargement. That's pot-bellied appearance. That's a common manifestation. And it gives you a pot-bellied or pendulous abdomen. And again, we talked about it, weakened abdominal musculature, increased abdominal weight from fat redistribution because you're breaking down the fat so the animal can make glucose out of it and everything. Also from big liver, because where's a lot of that fat going to be going to? And a full urinary bladder, because what have you done to their ability to reabsorb the water and stuff? You messed it up because the effects upon ADH and stuff, and so you'll see this. Okay. And here's just showing you abdominal radiograph from a Karen Terrier with pituitary-dependent hyperadrenocorticism. And what about the size of that liver? How big should the liver be?
Not that.
No, that's not a good answer. Not that. Okay. You can see it's coming down like this. Should come down like this. There should be 2 to 3 ribs beyond it. I'm not seeing that. So that is big liver disease, right? And also, if you can see sometimes on radiographs, you can see calcinosis cutis. It's not showing up too great in this one. Basically, the spine, you can see increased density in the vertebral bodies and spines of the vertebral column. That can also occur from dystrophic calcification. And large bladder doesn't show up too well in there, but the whole back clear spot back there is the bladder. Okay. And here again, that red lesion right there is where you have calcinosis cutis also. But see, you know, these dogs, this is a little dachshund. Are they supposed to be like that? Or are they supposed to be like, you know, like that?
Well,
I used to have miniature dachshunds, so you know, they're supposed to be trim and everything, right? Actually, mine were, but
most of them are.
most of them are, yeah. But my dachshunds, they lived. One of my last dachshund died, and she was 18 years old when she died. Okay. Here again, this pot-bellied appearance right here, and notice the alopecia and stuff. This is a poodle. Doesn't look like a poodle, does it? Because it's a sick poodle disease. Here's another one. And this one doesn't look too happy, does it? Okay, abdominal distension, muscle wasting, alopecia, thin skin. See all the vessels on that side of the body wall there? You can see the vessel tracts and stuff. Here's another one. There's a boxer that has this problem. And they are supposed to have more curve down in their abdominal area, aren't they? Notice you got hyperpigmentation also there. Okay, polyuria polydipsia is very common. And this is because with too much of your, excuse me, as we said before, too much of your glucocorticoids inhibit the receptor in the tubules for ADH. And so what's that going to cause? That causes nephrogenic diabetes insipidus, right? Okay, nothing wrong with the, the neurohypophysis, but hormone can't work. Okay. Electrolyte disturbances are relatively uncommon. If the adrenal-dependent hyperadrenocorticism should involve the zona glomerulosa, you can get excessive glucocorticoids being produced. What's that going to do to blood sodium levels? Increase them. What's it going to do to blood potassium levels? Can that be a problem? What can hypokalemia do? Well, we got to go through the process before we get to that. What can it do? Huh? Doesn't affect the heart that much, but it causes weakening of all peripheral musculature. Animal can't raise its head. What's that going to do to its ability to eat? Also, a little muscle, that inconsequential muscle called the diaphragm, doesn't work as well. Is that going to cause some problems? And so it doesn't, the hypokalemia doesn't really affect the heart that much. Hyperkalemia is the main problem there, but it affects all the other peripheral musculature going on. Okay? You can't get azotemia again, that's just increased non-protein nitrogenous substances, BU and creatinine. And so that depends on how bad you're using water. If you lock that animal away from water, it's urinating all the time, it's going to get pretty dehydrated, so that will vary. Okay, we're going to take a 10-minute break, and then we're going to come back and do our last. And let me have the second roll. Now,